Hi, Luca. Welcome to the
Hi.
podcast. I'm very happy to have
Hi.
you here. So, what I'd like to do is to start from your own personal experience and then get into what you learned and what are your opinions on the market and on healthcare in general. Many people in the tech space know you for your role as manager and CEO for a long time in the Sant'Agostino Clinical Network in Italy. And I would really like to start from this and really like to your education as well. So I'm very aware that the path to entrepreneurship is very different for every person. There's no standard path to entrepreneurship, and your path was definitely not standard. But I saw you studied physics and financial mathematics. And so I was wondering, how did you get into the healthcare space in the first place?
Okay, thanks Gaia for having me here. Yes, I started studying physics in this special university in Italy called Scuola Normale Superiore. It was an exciting period. I loved what I did, but what I discovered was that some of my fellow friends and students were super smarter than me. And so they were fast in solving problems in physics and mathematics, and they were able to do things that I couldn't do. And that was for me an interesting point. And there I decided somehow that I wanted to use my brain in other areas, not only in physics and mathematics. So I entered into this financial mathematics PhD. In practice, what I did was deciding from scratch that I didn't want to go to the university for an academic career. And I simply wanted to use those 3 years for learning what I didn't know, and in my opinion, was important for me in the future. That basically was economics, finance, and management. So I spent those 3 years studying on my own all these issues. So I arrived very late in my life at 29, basically without a single day of work and having spent all of my time thinking and studying and understanding something about the world, but in principle and in an abstract way. Then, in the last 6 months of the PhD, I entered in a bank, Commerzbank in Germany, and I saw with my eyes that kind of environment wasn't very nice for me. I was not so interested in simply making money, in going in the morning in front of a computer for exchanging stocks or stuff like that. And so I decided to enter in a company in Germany that were building microfinance banks in developing countries and in so-called transition countries, transition from communism to capitalism. So I worked 1 year in Kosovo, I worked in Africa,
Wow.
South America, Ukraine, Romania, and all these countries. Then in 2005, I decided to come back to Italy. I was in Germany in that moment and I was around the world. Then I decided to come back to Italy and to build up my first startup. I developed from scratch a startup. I was the CEO that was developing, let's say, programs for mobile phones. But in that moment, mobile phones were all Nokia, 85% Nokia. Of course, 2005. Then in 2007, phone arrived. Let's say in 6 months, the market changed abruptly. So all our technology could be taken and put in the dustbin.
The beauty of innovation, right?
Exactly. Sometimes failure is because you cannot forecast really what kind of innovation will arrive in the future. And so in 2009, I went on managing the company, but it was not a glorious exit like all startups would like to do. So in 2009, I entered as a CEO of this small clinical center in Milan. It was the first time for me in healthcare. And then from that moment on, from one center to 45 center for 14 years, I was the CEO. And that period was the period in which I could study, understand, and work on healthcare. I was super lucky because I was able to do what I wanted to do in that moment. I didn't have many issues like a person that works in a big hospital may have. It was a startup, so I could build up from scratch all my team and all our products and everything. It was super fun. So yeah, it was this the way I entered in healthcare. So basically, I'm a scientist and I'm using science and scientific approach in everything I do. I spent few years in finance, and so for me, entering in healthcare, the financial part was quite easy to understand and to grab. And the specific know-how in healthcare was built in 14 years doing it somehow.
This is really beautiful because I feel like you got into healthcare in a, we could say, random way. Like you didn't select the industry per se. You selected a way of working, a way of thinking, and you just apply to whatever it was, coming across your life. I really like this thing. And also I think it's very unconventional, the fact of not being limited and not having limiting beliefs when choosing a university and choosing the first job. You just, went down your road according to what you liked or not liked. So I think this is really interesting and probably is the reason why then you could build what you've built. And I was wondering, you said, okay, and then I got to this clinic, which is Sant'Agostino today. Can you share the story of how that worked? Because I feel like it's a very atypical project. Because if I'm not wrong, it was born from a VC as well, right? It was not founded as a startup at the very beginning in a normal way.
Okay. Sant'Agostino started in the head of a person, Luciano Balbo, fund, the first impact investing fund in Italy called Oltre Venture. Let's say that they started working on it in 2007 and they opened up the first Sant'Agostino in Piazza Sant'Agostino in Milan in 2009. Now, in 2009, they started, and I was the fourth CEO of the company in a few months. So basically, they were looking for the right person managing it. But somehow, the first Sant'Agostino was built by a venture capitalist. And they needed somehow an entrepreneur managing it and creating the future for it. So after a while, somehow I met Luciano and he asked me to be the CEO of the company. I spent a couple of months watching at it, understanding what it was. And in that moment, I decided, okay, let's try it. And then I entered. What was Sant'Agostino in that moment was one clinical center, 800 meters, so quite small somehow, with a new idea for that moment that was let's try to have a pricing that is more or less in the middle between the private marketplace in healthcare and the public co-payment in the national health care system. So in that moment, the co-payment for a visit was 23 euros. The market price for a visit, a specialistic visit, was around 120 euros. We decided to put at 60 euros the visit. So the idea was, okay, we are private. We are not asking money to the state, to the taxes of citizens. So people that come to us pay for the service out of pocket, mainly out of pocket. But the pricing is affordable. And then at that point, we also decided to have a qualitative, very good service. So typically you may think, okay, the price is low, doctors are not so good, the places is not nice, and so on. So what we did instead was doctors were good, and the places we had were super nice. Of course, the first year we closed a P&L that was not super nice. So the first year we had around 600,000 euros income and 1 million losses. That was the situation when I arrived. And so I had somehow to take care of how to build up something that was long-term and scalable. Said in a very short way, I took two decisions that were afterwards in the following years the main decision for the positioning of the company. The first decision was, okay, I couldn't afford super expert, well paid. It was impossible. So I decided to build up the company with people just out of the universities. And basically, they were trained by us. And the young people had a lot of responsibilities from scratch. This was one decision. It was a decision compatible with the idea that we wanted to change the market. And therefore, I needed people that were open-minded and ready to do different things compared to what the standard was doing. So this was the first decision. The second decision was that it was impossible to have the same amount of people managing and delivering services than typical healthcare providers. Again, because with that position, it would be impossible to have a P&L sustainable. So what are these possible solutions? Technology. So we had to implement as fast as possible the best technological possibilities in healthcare. And in that moment, 2009, it was not difficult to understand what we had to do. So basically, we had to have digital bookings. Nobody had it in that moment. So we were the first.
I really wanted to ask you about that because now it seems like, okay, of course you have to digitalize some processes to make it more efficient and less costly, right? But then back then I came across a video of you, I think, and Luciano Balbo interviewed by some like television program, and it was really great to see how you were embracing this as a complete novelty. So I was really wondering, was there nobody in the space doing this at the time?
Nobody. In that moment, 2009, we were the first having online booking in Italy.
Incredible.
A few years after, I think 2011, we were the first to have the automatic check-in when you entered in a clinical center.
In the clinic.
In the clinic, okay? Today is super normal. Basically, in Milan, at least, you go everywhere and you have the check-in. And third, we were the first to have the credit card of the patients in a way that the patient could get out of the room and without stopping by for paying or whatever, everything was done without a single queue. So basically, we developed the first patient experience without queuing up in healthcare.
Amazing.
Okay, it was all about technology in non-clinical stuff.
Yeah, like, why was nobody doing that? Because if you had the technology, the others could also have the technology. Was it about the flexibility that you mentioned before, that you could do whatever you wanted at that time, or what, something else?
First, when I arrived, it was clear to me that all the historical guys had legacy system. And for them to modify legacy systems was quite difficult. Okay? Then they had the legacy relationship with doctors. And for an hospital in Milan to modify contracts with their doctors was super difficult, you know? And for me, it was a new contract.
Yeah, you didn't even know the people maybe, so.
Yeah, exactly. So I could build up the contracts in a way that was compatible with what we were doing. Third, leaders of healthcare companies didn't have any technological mindset. So they were basically people built up in the healthcare community. So they were thinking and managing the clinical offer somehow, not the technological infrastructure around the hospital. So for them as leaders, was quite difficult to understand where to go, when to go, and how much and how fast to go in a certain direction. I was coming from a technological mindset. So for me, it was a no-brainer. It was I arrived and I said, okay, we should take out all Microsoft computers from the day after out because they create a lot of problems. We have to be paperless. We have to be serverless. We were the first in healthcare being serverless. And when I was talking in that moment with other guys in healthcare, it was super fun for me because they were all about, but it's risky to not have data in your physical server in your hospital. I was saying, guys, it is risky to have it there.
So what you're saying is we wanted to maintain very high quality of services, but lower prices. So the trick was really implementing technology and dealing with doctors that were not at the top yet. So we could work with them in a different way.
The point is that in 2009, there were two different conditions compared to today. The first condition is that the year before, there was a crisis around the world. So families were very, very, very sensitive with a lot of attention to their expenses. So we were arriving at that moment with a model that could allow them to spend half what they were spending in the private healthcare arena. And therefore, it was quite easy for us to penetrate the market in a fast way. At the beginning, the first time, the people were thinking, okay, these guys doesn't provide very good services because they are low cost. But then after the first time that a person could enter in Sant'Agostino, they saw around the situation, they had the experience, and from that moment on, they were hooked by us. No, in those years, for healthcare, Sant'Agostino was the only possibility because they could, book in few seconds. They arrived and they could enter into the room with the doctor at the right time. And
incredible,
they were
right?
Incredible. I mean, I'm saying things that in other services are normal, but in healthcare, in that moment, were quite incredible. No? So this was the first issue. The second issue in those years was that there were quite many doctors in the market. So I could get doctors that didn't have the agendas full in other providers. Therefore, I could have contracts with them in which they could earn quite good money, but of course, I was not too much in competition with others. This was the situation. So it was the perfect situation for that model. We didn't know in that moment that was the perfect situation. And also, we didn't know that Milan was the perfect market where to enter, because Milan is a unique place in Italy in terms of people living there and behavior of people living there. So basically, in Milan, you have a lot of young professionals, a lot of young students, and we discovered that the Sant'Agostino model was perfect for this kind of guy.
I was gonna ask you about this, about patience and like behavior and adoption, because what you said before is, yeah, you could enter and click and book and do everything digital, super comfortable, but today is the standard. Once it wasn't, and I totally imagine that there were some resistance from maybe older people.
You have to imagine that we had less than 14% of over 65. So the big majority was in the working age. The peak was at 30. So basically, we were providing healthcare services for healthy people, not for sick people, not for people with important pathologies. Also because who has important pathologies is quite well covered in Milan by the national healthcare system. But if you are young, you arrived in Milan for studying or for your first job, you don't have your general practitioner there, and you are a woman, you want to have a gynecologist that follow you for basic yearly visits, or you don't have one, or you want to have one every year cleaning of your tooth somewhere, and so on, stuff like that. So stuff for healthy young people. We were the first choice by far.
And did you see some shifts into this perception during the years? Like, did your, let's say, graph of average age increase, change?
So what happened was that at the beginning, we had youngsters. Then the clinical center in Piazza Sant'Agostino was the one in which the penetration of the market was more advanced. And we could follow the age of people in that center. And so we saw after 7, 8 years that the over 65 people, the 50 years old people started to come over there more and more and more. 7, 8 years. And what happened? We asked to the people was quite simple. So youngsters arrived to have a family, and then they had their parents or grandparents that had health problems, health issues, and they could come. So this was the first point. The second point was that we enlarged our clinical offer. So at the beginning, for example, we didn't have blood testing, we didn't have imaging or radiology and stuff like that. Year after year, we enlarged our clinical offer. And of course, when you have a magnetic resonance, it's without an age. So whoever had to do a magnetic resonance as fast as possible could book and come to us. So we started to have more and more people with more advanced age. And after 14 years, who started using us at 20 was 34. So basically, there was a movement because the people get older.
I see. And this probably leads me to a even bigger question, which is today, it's no secret we have a demand that exceeds the offer in a like increasing way. So we don't have enough doctors. They're mostly old. The situation is really unbalanced, and this is growing and growing in time. So what I'm wondering is, I can see that your approach, your database approach, your technology-based approach in Sant'Agostino was definitely a winner approach for the time and for the present. I'm wondering if this same approach can be adopted by both private and public system, maybe even partially, to make this unbalance between demand and offer a little bit better. I know it's a huge question, but maybe you have some strong opinions here.
Okay, I have a strong opinion, but the exercise now is to give you an answer not in 2 hours. So let's try to give you an answer in 10 minutes or 5 minutes. Yes, everything you said is true. So at the end, what is happening, if you look at the bird high level, what is going on, is that the demography of patients is changing continuously year after year, abruptly. So basically, for giving you a number, in Italy, between 2010 and 2045, you have less 9 million people in the age 20 to 64. And in the same period, you have plus 7 million of over 65. These numbers give you immediately the perception of what is going on. If you translate these numbers in how much you should put on the table in terms of money for the healthcare, you have an inflation of the money of 3% per year, somehow. In a country, Italy, that doesn't have 3% per year of GDP growth. And so if you simply let the system go on in terms of, okay, let's keep the quality as it is, but with a demography that changes, you will have more and more and more GDP going to healthcare. This is unattainable politically, at least in Italy. And particularly, the expectation of people are changing year after year. If you take a guy in the 1960s and the guy today, and you compare their expectations in terms of healthcare, they're completely different. So the expectations now are very high. Good. So how can you manage this? So basically, there is only one central solution, that is technology. But this time is not technology about the non-clinical stuff, but is technology in the clinical stuff. You may have, in the meantime, some partial solution in changing the responsibilities of different people in the professional area. So basically, you may, for a while, waiting for the technological advancement in healthcare, ask to nurses to do what the GP does today. You can ask to people that are under nurses to do the nurses stuff today, and so on. So you can move the responsibilities in a different way compared to today. But we need technological advancement in several areas till the robotics. So till the moment where you have robots doing what today people are doing.
So what you're saying is, trying to sum up, just moving up into the chain of resources. So really like identifying not really the roles of doctors and professionals, but what they are able to do. And based on that, make them do what they can do and make the technology do what they are not necessarily needed to do. What I'm wondering is, like, let's take the Italian NHS, but I'm sure is the same in many other countries in Europe. If technology was adopted already for all the administrative tasks that you said before, so not really the clinical one, I guess we already would have a very big gain, because this is definitely not implemented.
It's a little bit different. So when you talk about administrative tasks, you are talking about in practice two different things. One are administrative tasks done by non-doctors. Okay? So booking, payments, all this stuff are not doctors doing it. Then many times doctors talk about administrative tasks they have to do. In practice is about the fact that doctors have to fill up information inside the IT stuff.
Like the medical records.
And so on. And therefore, what doctors say to you is, okay, we have 20 minutes for a visit. I spend 10 minutes writing and only 10 minutes talking to the patient and visiting it and doing stuff. This kind of administrative things can be eliminated almost completely by technology. So this is one point. But it's much more than that. There are many cases in which you should not have that meeting with the patient. There are many cases in which digital information sent via chat is enough. This is one point. There are many cases in which what the doctor prescribed to the patients is wrong. And so we have magnetic resonance, blood testing, other visits, and so on that should not be done. And this is creating less demand for the system. If I have to tell you, educated guess, 50% of what is happening in terms of healthcare is not useful.
That's interesting.
So if you look at it and you believe for 1 minute of what I'm saying, the first thing that technology should do is to eliminate a lot of stuff people do that are not useful, okay? And to concentrate all the activities to what is useful, what is about the healthcare of people, you know? I think people don't understand, for example, is that the main point for staying healthy is not the healthcare providers' services. The main point are behavior of patients in their life, what they eat, what kind of physical activities they do, and so on. And my experience is that doctors don't do almost anything about it.
You know, like, I'm living in Berlin right now and everyone is talking about longevity. And in the States, it's all about longevity. But then longevity at the very end of it is really about prevention, on what your grandma used to tell you, like, eat well and do sports and sleep well.
Exactly.
And that's like 80% of the job.
Exactly. And basically, there is also an economic issue. It's economically, it's much better to have a 20 minutes visit at 150 euros that to take care in the long run of a person. It's difficult to get out money out of a person in the long run, doing stuff that are about eating, that are about sports and so on. So this is a huge issue. And therefore, if we want to keep our health, we need to do that. Health is mainly about grandma suggestions.
I feel like, of course, what you're saying is healthcare is often based on economic incentives. And what are the incentives of the different stakeholders? What I think is that, of course, public healthcare should not think just about the economic incentives, maybe should be the one changing a bit the balance among incentives and what's actually being done. I have one last question for you about this. Basically, two big examples of what you just said that come to mind are the online anamnesis. So really like the whole medical history done online, not by a person, but by AI, by any digital media, which, as you said, like just takes hours away of the doctor that can maybe dedicate their own time on something more relevant. And the second one is all the clinical decision support softwares. So all those softwares that put together data and in a very specific way and precise way suggest doctors what to do next with that person. What I'm seeing is in my own job and in the jobs of many other people I know is really difficult to go over the cultural of doctors and of patients. So what I see as a big limitation is not just the investment into healthcare, which Italy is currently cutting instead of increasing, but also the culture of people, which has to change, of course, but it's always the difficult part because it's quite long term.
Okay, so first, I'm in conflict of interest answering you about this question because I'm co-founder of a company that is doing exactly that. So it's taking data out of medical records of patients and is helping the providers to inform patients what to do, when to do, taken out from what doctors wrote in those medical records.
Amazing.
And we will go on implementing a system in which we take all the medical records of a single patient and we analyze the situation of that patient given the medical records, and we are able to suggest to doctors and eventually to the same patient what to do, how to do it, and so on, that is compatible with literature. So going more towards the evidence-based medicine, that is something that not always is followed by doctors. Okay, so this is the first point. So I'm in conflict of interest, but I'm working on it continuously, day by day, so I know quite well all the challenges and the costs and the difficulties. You are right when you say that there is let's say, patient and doctor resistance in terms of adopting these solutions for different reasons. But I'm a scientist, as we said at the beginning, and so I believe that at the end, the working truth will win compared to everything else. So when at the end, these systems will be so powerful that can help in the right way doctors in diagnosing in the right way what is happening to the patient. They will be able to explain to the patients a lot of things for their understanding of their own health and what to do and when to do it and how to do it at the end, with which doctor doing it, for example. Of course, this will create a condition in which patients will love it. I have no doubt about it. But you need a well-functioning system in the hands of patients. So today in a mobile phone, tomorrow I don't know which user interface we will use, but at the end, that's the final game of healthcare. When you have all your health with all your data inside a system that you, patient, manage, and you, patient, decide which doctor, which family member should have access to your data. You have an accident and the ambulance arrive, and in one click, you let the guys from the ambulance to have all the information about you, and they can take care of you in a very fast way. When you have this situation, I don't have doubts that patients will say, okay, I put all my data in Facebook and in Instagram. Maybe I can put also some of my data in the hands of whoever can help my health in the future.
I also have no doubt. I mean, that's the dream, and I really hope it's going to become true very fast. So let's trust the process.
Let's participate at the process.
Let's participate.
I'm not for trusting and that's it. I want to create the future.
Okay, so I have one small question, which is I saw you started a venture capital studio very recently. I don't know if you want to share something about that or what you have as a vision.
My vision is you need to build up good companies in societies that are going well. Okay, the idea that we can go on with the previous companies and so on is well showed and known that doesn't work. If you want to have innovation, you need new companies. Then, second step, many times those new companies are built by first-time founders or are built by second, third-time founders that are super strong in the product they create, but they lack experience in doing many different things that you need inside a company. Then you have people like me that spent 20, 25 years as entrepreneur uh, building companies in various phases. So I arrived till 60 millions income. Somebody else will arrived in companies with billions of income and so on. But basically, you have people with experience that can help the building up of these companies. My idea is that you may have in the market a different structure in which you have a startup studio like the one I'm doing, that is building up as co-founder companies together with guys that will follow the development of that company 100% of their time. And the startup studio take care of many of the things that are quite obvious in building up a company, but that for young people is a pain in the ass to do it. Okay, so that's the idea. That's the central idea. So I put the pre-seed money, let's say in the range of 100,000, 150,000 euros, together with other co-founders. We work a lot before creating the company. First, for understanding if the company makes sense, because maybe it doesn't make sense, or there is not a defensible market, something that you can create and you can defend from competitors for enough time for building up a huge company. Well, if we decide that makes sense, we create the company. Okay, I take a minority stake, 20%, 25%. This is the typical minority stake I take. I'm a co-founder. So I enter into the company as co-founder. I work together with the people day by day. The only point is that I'm a part-time co-founder. So I work for 20% of my time somehow in a company. Why? Because in the meantime, I'm building other 4 or 5 companies. And I create, therefore, together with other co-founders, that company. And then we simply try to do what everyone is trying to do, to grow as fast as possible, as much as possible. Basically, what I would like to show first to myself, I'm investing all of my money at present, that this kind of model is working, is something that we need in the market. In particular, now in Italy, we will have some more money because the government made this rule that pension funds that invest at least 5% of the total amount of money they manage will have some tax exemption, something like that. So we expect the doubling, the tripling of the amount of money VC arriving in Italy. And therefore, if we don't want to have a system in which we have more money, but the same quality of startups, we have to increase the average quality of the startups and the number of startups. And so in this moment, in my opinion, I'm not alone in Startup Studio in Italy. There are other guys that are doing a fantastic job. So I wanted to go on being an entrepreneur, but I decided that I didn't want to be a CEO of a single company for another 10 years. And therefore, this is a way I can follow for being an entrepreneur. If somebody asks me, you're more an investor or you're more an entrepreneur? Definitely, I'm 85%, 90% an entrepreneur, 10% investor. I like to build up products. I like to work with the people. I like to watch what is going on in the market and find out if there are holes in which we can enter, and then we can enlarge the hole. this is what for me, a great day. To find out something like that, to find out a great entrepreneur with which I can co-found a company. To open up my computer in the morning and to see the income going up, the EBITDA arriving at a certain point, results, customers. So are the stuff I love.
Amazing. And I'm sure that your future and present co-founders will be also very grateful to have you on board in an operational way. So that's all very exciting.
Let's see. You can
Let's
ask
see how
them
it turns out.
in a few years.
I will, definitely.
I may be harsh. I can be harsh in certain moments. So
But
it
then they
depends. It
only
can
have 20% harshness.
exactly,
It's fine.
exactly. That's true. That's true.
That's
In
fine.
small doses,
Exactly.
it's affordable.
Nice. One last question to close it. You entered into health. I wouldn't say by chance, but it was not the only option. And now you're keeping being into health. Why is this sector so relevant? Like, would you ever consider other industries?
I mean, I'm so curious about the world that I would love to be in 10 different industries. Then I'm human and I'm limited in time, in a network, in intelligence. So at the end, I think that a piece of maturity is about to understand your limits and to concentrate your efforts in something in which you can create value for the world. After 14 years in Sant'Agostino, when I got out, in the first days, I got so many contacts from people that wanted me to do things with them. But all of them, almost all of them, were because I was an expert in healthcare. And so for me, investing in a startup in healthcare that uses AI, that is my industry at present, is much, much easier than investing, for example, in clean energy stuff or fintech or something else. And it's not that I'm not interested in that areas, or I think that healthcare is the most important stuff in the world and you can't do anything else than this. I'm not so, let's say, driven only by what I did in the past. But basically, at this moment in my life, I'm 52 and I know very well this market. I know very well how to manage stuff in this market. I'm so fast in calling the right people, in understanding which products works, which products don't. And therefore, this is the reason I'm into it. But for example, my startup studio, when I will show to me first and to the market afterwards that it works, I would love to have other partners in other industries. In a way also that financially speaking, the risk is well distributed. And also, if it works, it can be something that provide a certain number of startups, new startups per year that enter into the arena and allow those money that wants to invest in new companies to good startups. That's my idea.
Thank you. It was super interesting. Thank you for your opinions and the transparency. And I'm looking forward to see what all of this is going to be in a few years or even months.
Thank you, Gaia, for inviting me.